Welcome back and thanks for staying with us. Workers at the Northwest Health Department have vowed to continue striking until their grievances are addressed. They allege the department is not complying with COVID-19 protocols. The workers claim primary contacts of those testing positive for COVID-19 are not being traced and given proper attention. They claim the department does not fully decontaminate areas where positive cases are reported in the building. They also say the Labour Department has found the building to be non-compliant to health and safety standards because there's no ventilation and the building is in a dilapidated condition. For more on this, we now cross to our colleague Kea Moalusi. Kea, what is happening this morning where you are?
Thank you, Desiree. This morning, as you have correctly explained, that we are at the Northwest Health Department where workers have downed tools. They are saying health protocols are not adhered to, especially the COVID-19 protocols they not complied with. Now, they're saying they can only go back to work as soon as the Premier of the province has addressed them. But to hear more about what is happening, I'm joined by Khomotso Sechukgo. Khomotso, what is happening today? In a normal instance, you're supposed to be in the building working, but you're not there. What is happening?
Department of Health. And then we have been complaining for such a long time with non-compliance in terms of COVID-19. We even also extend our complaint to Labour Department to assure that what we are complaining about is true. There was an issue, there's no ventilation because we work in an area, the open space, there's no windows. Secondly, some offices are overcrowding, whereby we experience a lot of infected people because of their overcrowded spaces. We try to talk to all the channels of management in the department to the level of the MEC, but we are feeling that our demands are not yet adhered to, and it seems like no one cares about what is happening. We are losing people every day in this department. It's almost 4 workers that have already passed on due to COVID cases, and some of them we are rest assured that they got that infection from the department. So as workers, we decided that because we feel it's not safe for us to be in the building, so that we should wait outside so that we can able to talk to the Premier. Premier must assist us because we followed all the protocol from the director up until to MEC's office. But no one is taking this thing as a serious, and it's affecting us emotionally. So hence we decided that because the building is not safe for us to enter it, even Labour has confirmed it. So we decided to go outside and wait for the Premier to come and address us as a political head in the Northwest province.
But what is it exactly that you are expecting from the Premier? What kind of intervention are you expecting from him?
The intervention that we're expecting from the Premier, because we've got to believe that he's getting a false report in terms of compliance, in terms of COVID regulations. So we wanted to give him a portfolio of evidence, how we are overcrowded, how do we work every day. It was only after the third death that people with chronic, people over 60, pregnant people were released to go and work at home. But all along, they've been working, chronic people, 60 people, and people with pregnant. After we have went outside, after that death of another person, that was the time then the statement was taken out that people must go back, must go and work at home. But it tells us even if we didn't take that action, those people could have been here. The chronic people, the 60 years people, and also the pregnant people. Some of the person who passed on, she was pregnant and she was still coming to work. So it's our concern, we need the Premier to come and see, because we believe that the report that he's getting from management of this department is not a true reflection of what is happening here. Even if yesterday, after we've got a report that somebody passed on, 2 people were identified from the same section that tested positive.
So what if the Premier doesn't come to you and address you as you wish? What's going to happen then?
As much as they always say that we must follow protocol. As I mentioned before, we follow protocol to the level of the MEC. Now, MEC is reporting to the Premier. We want to talk to the Premier. If the Premier is failing us, we are willing We are willing to go to National Department of Health and go and talk to Dr. Mkhize about our frustration in this department. We are willing as workers to make sure that we go there and tell the minister about our frustration in this department.
As you heard there, Desiree, workers say they can only go back to work as soon as the Premier has addressed them and haven't gotten a full report of what has been happening in this building. Back to you in studio.
Well, let's give you other news.